Hi, everyone. Thanks for joining us. I'm Jonathan Modi with OHA External Relations. I'm joined by Dr. Dean Sidelinger, Health Officer and State Epidemiologist, who will answer your questions about our announcement today that the state mask requirement for healthcare settings is lifting April 3rd. Just a friendly reminder that to please mute your audio and use the raise your hand function if you'd like to be added to the queue to ask a question. Please, please, please make sure to include your media affiliations so we know you are with the media. If you don't include your media affiliation, you'll need to join on the YouTube. But if you are on the YouTube, you have to go over to the YouTube live stream and you'd like to log back into the Zoom to ask a question, just make sure to include your media affiliation so we recognize you. Let me see. Also, we will be granting permission to record one by one. It does take a little time, so please be patient. After you ask us for permission to record it, it might take a moment. And just one last bit of housekeeping. A reminder that a recording of this media availability is at the YouTube link that was included in the advisory for this event. And if you couldn't find it or you're not sure where to find it, just send a note to phd.communications@oha.oregon.gov. That is just the standard PhD communications, public health division communications email, and I'll send you the link to the YouTube. So with that, I will let Dr. Sidelinger kick it off.
Thank you, Jonathan, and thank you all for being here. Let me start by saying I'm sure you've all read the media release, so I'm not going to repeat everything in there. But lifting the masking requirement in healthcare settings is a positive step in our ongoing response and battle with COVID-19. Indicators of spread of COVID-19, as well as influenza and RSV, have decreased significantly in the last few months and are continuing to show a declining trend, which is great. The impact on our healthcare system from the most recent surge of respiratory viruses, including RSV, influenza, and COVID-19 is also diminishing. So we know that beds are very nearly full in many facilities and across regions in our state. So we still have people getting sick with COVID-19 in our communities. For many, they're greeting this announcement with happiness, that this is a great positive step as we move on from COVID-19. For others, particularly those with chronic conditions or who are immunocompromised, they're facing this decision with some anxiety, as having everyone wear masks in healthcare settings has provided them another layer of safety as they seek care, because they could more significantly be impacted if they got sick with COVID-19 or influenza or RSV. So know that we did not take the decision to lift these mask requirements lightly, but that the rates of all these diseases appear to be going down, and that individuals, I think, who are at higher risk for COVID-19 should still consider wearing a mask in indoor public places, including healthcare settings. Being up to date with your recommended vaccines can also offer us some protection. And individual healthcare providers and healthcare settings may still choose to require masks in their places of business. And they will do that based on the types of care that they give, the locations where they are. And so check with your healthcare provider to see if that requirement still continues. That will be left to the individual settings. And I want us all, as we move forward in this setting, to support each other in our decisions. If an individual chooses to wear a mask, we should support that. When an individual chooses not to wear a mask, we should support that. But if you're at higher risk for disease, I encourage you to continue wearing that mask. If you have symptoms consistent with COVID-19 or influenza and you need to seek care, put on a mask before you go to seek care. And that's another step we can take in keeping us all safe. And with that, I will turn it over to Jonathan. We can start taking questions.
Okay, Thanks, Dr. Sidelinger. Yeah, just a reminder, please use the raise your hand function if you would like to ask a question, be added to the queue to ask a question, and make sure to mute your audio if you're not asking a question. And again, if you couldn't get in because we couldn't recognize you, and you are listening in on the YouTube live stream, hopefully you made it over there. You are a member of the media. And you want to ask a question, jump onto the Zoom link again and just make sure to include your media affiliation. Okay, so let me see. I see first question from, I apologize for not recognizing the name here, but KM Bartley. Go ahead.
This is Kendall Bartley from KVAL News in Eugene. My first question is, of course, for Dr. Dean Sidelinger. So with the removal of masks in healthcare settings, are there concerns that these viruses will increasingly spread, especially among those healthcare workers, when we are already dealing with a healthcare worker shortage?
Thank you. I think that's one of the reasons that we see that we have had the requirement in healthcare settings longer than the requirement for masking in other settings. Healthcare settings are unique because people who have symptoms of COVID-19 or have COVID-19 and influenza seek care in these settings. Individuals who are more at risk for severe disease also seek care in these settings. And the healthcare providers who provide care for all of us when we show up are exposed to multiple individuals. But rates of circulation, when we look at percent positivity and in our wastewater data for COVID-19, show that these viruses are circulating at much lower levels. We hope that individuals have taken advantage of being up to date with their COVID-19 vaccines, with bivalent boosters having been available for months, and those will offer some protection. We know that all of us who have recently recovered from COVID-19 do have some short-term protection as well from COVID-19 as we do from our vaccination. And so with all of these things in place, we feel that now we can remove the requirement for everyone to wear masks in these settings and not significantly increase the risk for individuals seeking care or for healthcare providers. Healthcare providers were exposed, in the community to family members who may have had COVID-19, to friends and in other public places over recent months. And that's likely where many of them got sick and not at work where they were wearing masks universally. Healthcare providers, like the patients seeking care, may still choose to wear masks in these settings, and that's their choice, and we need to support each other in those choices.
Thanks, Kendall. Next question is from Megan Allison with K2. Go ahead, Megan.
Hi there. Thank you again for making the time. A question for you as well, Dr. Sidelinger, kind of in the same vein. We've heard from families who have loved ones who are in healthcare settings like nursing homes, and they've witnessed outbreaks over the last few months. And so their question is, why repeal now when we are still seeing a level of that sickness in the community?
While I wish we could get to a point where we weren't seeing COVID-19 circulating at all in Oregon before we made any changes to our rule, we know that we're going to need to live with COVID-19 as it goes forward. The indications of spread are all going in the right direction. We're seeing a significant decrease already in influenza, where we have not seen a rise in influenza B come up later in the season, as we sometimes do, particularly in early flu season years. The circulation of RSV, or respiratory syncytial virus, has gone way down, and we're continuing to see downward trends in our COVID-19 numbers. So I think this is the right time to repeal this rule. The other steps that individuals can continue to take is to assure that they're up to date with their COVID-19 vaccine, with their annual flu shot, that they consider wearing a mask in crowded indoor places if they're at higher risk. So those with immunocompromised, older Oregonians, those with chronic conditions like lung disease may still wear a mask. And for all of us, if we're feeling sick and we think we might have flu or COVID-19, we should stay home. If we need to seek care for that, we should put on a mask before we go to seek care. And taking these steps as individuals will help us all keep ourselves safe, our loved ones and our neighbors safe, and our relatives and loved ones who are in these long-term care facilities where we know we've seen some of the greatest outbreaks and impact of this disease from the start of COVID-19.
And just a quick follow-up question on the other side of the coin, we've heard from people saying, if you're going to make this announcement, why wait a month? Why not just put it into effect now?
So this announcement is going to change mask wearing across all types of healthcare facilities. So we wanted to give our healthcare partners some time to look at what they would like to do. Would they like to keep this requirement in place because of the patients they serve or the type of care that they give, so that they have time to make that decision and talk it through? So that if they are going to remove this requirement, that they have time to think, what are all the implications and how do they need to do that in a smooth way? And for patients who are worried about getting seriously ill with COVID-19, our fellow Oregonians who are immunocompromised or have chronic conditions may feel increased anxiety because this additional protection step is going. So this will allow them some time to plan for how they're going to seek care once this rule is lifted, when not everyone is required to wear a mask. So we wanted to give everyone time to adapt to this, and we felt that a month's time was a good time period for people to do that. And so that's where the April 3rd date comes in.
Thanks, Megan. Just a reminder to please use your raise your hand function. And if you're just joining us, yeah, again, use the raise your hand function, but also make sure to mute your line before you if you're not asking a question. And those of you who might be over at the YouTube live stream, feel free to pop back to the Zoom and just make sure you have your media affiliation. Just wanted to include that reminder. And next question is from Lisa Balick, Coin TV. Go ahead, Lisa.
Yes, hi, Dr. Sidelinger. Question I'm getting from healthcare workers who I've spoken with. They're concerned about what happens if their facility still requires people to wear a mask, but people will come in and get into a confrontation like they did before, saying, I don't have to wear a mask. There's no state law that requires me to wear a mask. What about those situations? Is there going to be any kind of guidance as to how to handle that?
Thank you for that question. I think we would ask our healthcare partners to handle that in the same way they do now. For someone who comes in and is not wearing a mask, to offer them a mask, to educate them about the need to wear a mask, and to escalate that if the situation, if the person does not comply. Individual healthcare settings, providers can still continue to wear a mask, so they can offer that same suggestion, keeping masks handy at entranceways and doors, providing clear signage that says that masks are still required in this setting so that people know what's expected as they come in, and to remind people and educate them about the policy that they have so that they can wear a mask. But I wouldn't anticipate significant differences, as the state wasn't, on all those at all those sites, actively enforcing the current mask rule. And so it came down to those individual conversations when people weren't wearing a mask or were choosing not to comply with our mask requirements.
Thank you.
Thanks, Lisa. Next question is from April Ehrlich with OPB. Go ahead, April.
I'm just trying to gauge who this applies to. It's not just like hospital settings. It's also like what veterinary clinics and what physical therapy. Who's being impacted by this policy?
Yeah, I won't be able to rattle off the full list, but we can send you a link to the rule. But our healthcare setting rule and the providers that provide care in that rule is fairly broad. So this includes outpatient healthcare delivery, whether it's primary care, subspecialty care, physical therapy, occupational therapy, across multiple settings. Our inpatient care settings, hospitals, the associated emergency departments, and other places where individuals seek care. Long-term care facilities, including our skilled nursing facilities, memory care facilities, and other long-term care facilities where care is delivered are covered under our rule, as well as pharmacies. So a broad level of facilities, and all of those facilities will see the masking requirement go away on April 3rd.
And have you looked at other states who have dropped a similar rule and any after effects that happen? What was the impact in those states?
I think I haven't seen any specific studies that show the lifting of the health care masking rule and how that specifically impacted case rates. We know that that there are about a dozen states who have some level of healthcare masking rule in place right now, and there aren't masking rules in place in most other public settings. And so there's still ongoing exposure for individuals in the community outside of the healthcare settings, for those workers and staff and volunteers in these settings. So it's hard to tease out the specific impact of revoking a rule, and I haven't seen a good study that's looked at that in other communities or in other states. But I know that our neighbors to the north in Washington made a similar announcement this morning about removing their healthcare masking rule with the timeline of April 3rd as well, and we did have conversations with them and aligned those dates.
Thanks, April. Next question is from Jake Thomas with Lund Report. Go ahead, Jake.
Yeah, thanks. So I'm wondering if this is going to be, if the mask requirement in healthcare settings, this might make a comeback next winter, if this is just going to be like an annual thing where the weather gets, just every winter and fall, we might just have masks, like requirements like this.
So let me start with a little historical context. Prior to SARS-CoV-2 showing up in the world at the end of 2019, we know that influenza arrived with a fairly seasonal pattern every year. RSV and some other respiratory viruses showed up with a similar pattern. And so in many healthcare systems and communities, it became common to look at the spread of things like influenza, and when influenza was spreading at higher levels, to require masks be worn, particularly in hospital settings, to put visitor restrictions in place during those times to try and protect patients from the spread of influenza. That wasn't the norm across healthcare settings, but it certainly happened in the Portland metro area. Local public health and healthcare systems got together and used, a regular criteria to strongly recommend masking in hospital settings, especially. And I think we'll see more of that in the future. In this, I know we're still in the winter now, but in next winter's respiratory season, that we may see more healthcare providers who choose to implement masks universally in their settings. We also will be able to use this time in the summer as we go into the fall to have conversations with our healthcare partners, with patients and consumers of healthcare, our local public health partners and others who are interested, to say, what should we be doing in preparation for the next respiratory viral season? Because we know influenza will come back with a fairly predictable seasonal component, RSV will, and eventually we think COVID-19 may become a little more seasonal. So what actions should we take? How should we prepare, and what policies should we have in place to help protect the workforce that provides us the care that we all deserve, and patients and those who are seeking care. So I think this offers us some opportunity to have those conversations.
Thank you. And I know it's off topic, but I do have to ask if you have a reaction to the resignation of James Schroeder today.
Let me say I appreciate the leadership that Director Schroeder has provided in his time here at OHA. Certainly, it's a challenging time as you come into a new position with multiple opportunities, such as our federal Medicaid waiver, multiple challenges, including our houseless population and the impacts of substance use and mental health on many members of our Oregon's community. So it's been certainly been a pleasure working with Director Schroeder. And he, as he said in his announcement, wants to take some more time to spend with his family. Working, in healthcare and public policy, and healthcare can be all-consuming right now with so many things going on. And so I wish him the best of luck, and it's certainly been a privilege working with him in the recent months.
Thanks, Jake. Thank you. Next question is from Tim Gordon with KGW. Go ahead, Tim.
Hi, Dr. Sidelinger. You hear me all right?
Yes.
Good. Hey, a question. So I know that the providers have 30 days now to figure out how they're going to do this. But I'm wondering, it seems like in our canvassing them today, they weren't aware of this coming. And first I'd ask you, was that intentional? And then after that, do you have any sense of what they'll do?
Certainly, I think, the timing specifically, we tried to give some short-term notice to some partners that this was coming today, but we knew in setting a date a month out, because the trends that we're seeing in spread of RSV, influenza, and COVID-19 are all heading down, so in the right direction, and we don't anticipate that changing. This gives us some time to engage with our partners in those conversations, so that if they are choosing to make a decision to keep a requirement in place across their settings or in certain settings that they're responsible for, that they have time to do that, and we can have some conversations about what that could look like, and then longer term have conversations about what policies and recommendations could look like as we would approach next winter.
Can I just ask you then, the second part is kind of, do you have a sense of what they're going to do? Because what we're getting back is we're considering it and safety is our top priority, and that's it so far. Do you have a sense what they might do?
I don't, because we haven't had those conversations. But I think, again, giving a month lead time will give individual providers the chance to have those conversations with their staff, with their leadership, with the patients and consumers that they serve, and make those decisions. And so, a time to have those conversations is something we have in the next month. But again, I would also encourage individuals, whether you're a healthcare provider and you feel that you want to continue to wear a mask, to continue to wear that mask even after April 3rd. If you're a patient who's seeking care, and particularly if you're at risk for severe disease, to continue wearing a mask. And for all of us to support each other's decisions to wear a mask, whether it's in a healthcare setting, in a grocery store, and other crowded indoor settings, that we support each other's decisions, because Oregonians have stepped up time and time again during this pandemic, gotten vaccinated, gotten boosted, worn masks early on, stayed home, changed their behaviors, changed their lives. And because of that, we saved thousands of lives. And I hope Oregonians will continue to support each other and do what they can to keep themselves, their family, and loved ones safe.
Thank you. Appreciate it.
Thanks, Tim. Next question is from Paulina Aguilar with KPTV, and glad you could join us, Paulina. Sorry about the delay of getting you on here, but go ahead.
Hi there. Thank you. My apologies if you already answered this. Like I said, I'm a little late to the party. But you mentioned that the month time will give offices a chance to prepare the change, adjust policies, training procedures. Can you kind of just give an example of the kind of policies there would adjust to, or examples of training or procedures that would change?
I think, the providers have signage up net right now reminding individuals about the requirement to wear masks, and have trained their employees around the need to wear masks unless they're not in a patient care area and away from others. So certainly all of that would need to be changed. But I think the dialogue that they'll have to have is based on the population we serve, our staff, and our location, do we want to continue this or not? So it's a time to have that discussion about their desire to continue this. But I think for me, a really important piece of providing a month's notice is for those individuals who are immunocompromised, have chronic conditions, who are worried about contracting COVID-19 or influenza because they're at higher risk. This gives them a chance to prepare, to think about how they're going to access care after this, when they may feel less safe in doing so. I will say that for those individuals, again, this decision was not made lightly. We're seeing, downward trends across all of these circulating respiratory viruses right now. We know that we have widespread availability of vaccines and boosters, and we encourage everyone to be up to date with those. And we encourage everyone to continue to wear a mask if they are at higher risk for disease, if they're a caretaker for someone who is, or live with someone who is, to continue to wear that mask, and that would include in healthcare settings. So this gives them some chance to prepare and plan out how they're going to access healthcare after this requirement goes away. But there are several other things that they can do to protect themselves. And so I don't think this will increase significantly their risk of COVID-19 or influenza in seeking care, especially if they still choose to wear a mask when they're in those settings.
Thank you.
Thanks, Paulina. And I don't know if Joey Vaca with KEZI, he's having some, he has a question. And Joey, go ahead and drop it in the chat and I'll ask it on your behalf. The next question, then we'll get back to you. The next question is from Gary Warner with EO Media. Go ahead, Gary. Oh, I'm sorry, Gary, I apologize. You put it in the chat. My apologies. Gary's question was, let me just make sure I have it here. Okay, yeah, so Gary is wondering about whether we're going to see another booster this spring.
Thank you, Gary. Right now, all indications are that we're not going to see another booster for COVID-19 coming up in the spring. Our federal partners at the FDA, as well as the CDC, have met and discussed moving to an annual COVID-19 booster similar to our influenza boosters. The current COVID-19 bivalent booster that we got seems to be offering, holding up and offering effectiveness against preventing severe disease and death. We know that in the short term after that vaccine is given that it can also prevent infection as well. So I'd anticipate moving on to, more of an annual piece, and that individuals who've not yet gotten or who've gotten a bivalent booster, the next COVID-19 vaccine we're likely going to recommend you get is a COVID-19 booster sometime in the fall. We know that our federal partners are working, or our pharmaceutical partners are working on reformulating, initial doses and moving all potentially to a bivalent formulation, and that in the future that we may see a combination influenza and COVID-19 vaccine, but that likely won't arrive for this fall. But no, I don't anticipate any additional COVID-19 vaccine boosters this spring.
Thanks for that question, Gary. Okay, getting back to Joey Vaca with KEZI. He asks, in regard to the month waiting period before the mask rule is lifted, I understand Executive Order 22-24 expires on Monday, March 6th. What can we expect to see change after that order expires from a healthcare provider standpoint and general public standpoint?
Thank you for that question. Let me start by saying that the current masking rule is not tied to that executive order that was issued last year by the governor. That current executive order offered our healthcare partners, particularly our hospitals, some flexibility in caring for the large number of patients that were showing up for care. We had a confluence of increases in RSV, influenza, and then followed quickly by COVID-19, with multiple patients all showing up at the same time. Initially, we saw the surge in pediatric patients and later on in adult patients. So this executive order offered our healthcare partners some additional flexibility to be able to provide the quality care that people deserved when they showed up for care. So some staffing flexibilities that were offered allowed them to open up some parts of their healthcare facility that weren't typically available for patient care to providing patient care, and allowed us to work with our licensing boards to bring on out-of-state licensees, retired licensees in a quicker manner. In addition, OHA partnered with our healthcare partners to help bring in additional clinicians from out of state with some state money that paid for a portion of those, and then those contracts and those obligations went over to our hospital and healthcare partners, many of whom are continuing to pay for some of those additional care. So with the expiration of that order, it means that some of those staffing flexibilities and location flexibilities within facilities will go away. And it also means that we will go back to our regular licensing requirements for out-of-state and retired and other folks seeking to get their licenses here in Oregon. And we can let that executive order expire because of the significant decrease in demand on our healthcare partners. While it's not down to anywhere where they'd like to be, and we know that after 3 years of the pandemic, with our healthcare providers being tired and many having left the workforce, that people are still tired and there is still strain. It's not nearly the strain we saw earlier this fall and earlier this winter.
Thanks, Joey. Next question is from Heather Roberts with Oregon Radio News Network. Go ahead, Heather.
Thank you. This feels like the last kind of vestige of the COVID restrictions. Are there any other mandates or restrictions that the OHA will still have in place after April 3rd?
Thank you, Heather. I think what we look at is we still have a few rules related to COVID-19, some about reporting and lab testing, but then two that impact broader members of the general public are a primary vaccine requirement for K-12 staff and volunteers, as well as our healthcare providers across a broad array of healthcare settings. Those are still in place, and we are not rescinding those right now. We know that there are still some federal pieces in place, including a broader vaccine requirement for providers to receive payment for Medicare or Medicaid services to be up to date with their vaccines. And so we'll examine our remaining vaccine rule in light of that and other in light of that, our federal recommendations as well as spread of the disease. But you're right that most restrictions have gone away, including after April 3rd, a state requirement for masking in any setting.
Thanks, Heather. Follow up from Joey Vaca with KEZI. How do you expect the expiration of the order to impact these healthcare providers as they prepare for the mask rule to be lifted?
Yeah, I don't think that one will impact the other. As we've seen, healthcare providers have stepped up some of their contracting and brought in some additional providers to help provide care in their setting. We know that the patients with respiratory disease have gone down significantly, thus relieving some strain on the system. And so, and respiratory diseases circulating in the community have gone down significantly. We know, all of us likely in the last few months, either personally or know people who were had COVID-19 or had influenza because these viruses circulated at rather high rates. Our healthcare providers are no exception. Many of them got sick during this time and had to take time away from work, whether it was because they were ill themselves or needed to stay home and take care of an ill child or an older relative. So as disease is circulating less in the community, our healthcare providers will be less subject to getting sick and less subject to having to stay home and take care of ill relatives as well.
Okay, thank you, Joey. It looks like Joey's question was the last question. Maybe just wait a second here and see if there are any others. Again, just please use the raise your hand function and we'll get to you. Just give it a moment here. Okay, not seeing any. Thank you everyone for joining this media availability. Again, this recording of this event will be at the YouTube link that was included in the advisory for this meeting. So check that out. Also wanted to let you all know that we will be doing our monthly COVID-19 / respiratory season media briefing next Thursday, March 9th at 11 a.m. So look for an advisory with details about that. And if you have any other questions, feel free to send me an email at phd.communications@oha.oregon.gov. Have a great rest of your